121. What is the priority nursing action for a patient with a white blood cell count of 800/mm superscript 3? Answer: initiate neutropenic precautions and notify the provider. Rationale: severe neutropenia 1000/mm superscript 3 increases infection risk. Precautions and notification prevent infections, per CDC guidelines. 122. What should the nurse include in teaching for a patient starting radiation for esophageal cancer? Answer: report difficulty swallowing or weight loss immediately. Rationale: esophageal radiation causes dysphagia and malnutrition. Prompt reporting ensures intervention, per NCCN esophageal cancer guidelines. 123. What is the nurse's first action for a patient with a new onset of confusion and leukemia? Answer: assess for hypercalcemia and notify the provider. Rationale: confusion may indicate hypercalcemia or encephalopathy. Assessment and notification ensure timely treatment, per ONS leukemia guidelines. 124. What should the nurse assess in a patient receiving immunotherapy for lung cancer? Answer: assess for pneumonitis and colitis. Rationale: immunotherapy causes immune-related toxicities like pneumonitis and colitis. Assessment ensures early detection, per NCCN immunotherapy guidelines. 125. What is the priority nursing action for a patient with a potassium level of 6.2 milliequivalent/L in lymphoma? Answer: administer prescribed insulin and glucose and notify the provider. Rationale: hyperkalemia greater than 6.0 milliequivalent/L from tumor lysis syndrome risks arrhythmias. Insulin/glucose and notification address the emergency, per ONS guidelines. 126. What should the nurse teach a patient about preventing lymphedema after axillary lymph node dissection? Answer: avoid heavy lifting and tight clothing on the affected arm. Rationale: lymphedema results from lymphatic disruption. Avoiding trauma reduces risk, per ONS lymphedema guidelines. 127. What is the nurse's first action for a patient with a new onset of hemoptysis in lung cancer? Answer: assess respiratory status and notify the provider. Rationale: hemoptysis may indicate tumor erosion or metastasis. Assessment and notification ensure rapid intervention, per NCCN lung cancer guidelines. 128. What should the nurse monitor in a patient receiving cisplatin chemotherapy? Answer: monitor for nephrotoxicity and hearing loss. Rationale: cisplatin causes renal damage and ototoxicity. Monitoring renal function and hearing prevents complications, per ONS chemotherapy guidelines. 129. What is the priority nursing action for a patient with a new onset of fever in breast cancer? Answer: obtain blood cultures and administer prescribed antibiotics. Rationale: fever may indicate sepsis due to immunosuppression. Cultures and antibiotics prevent progression, per ONS neutropenic fever protocols. 130. What should the nurse include in teaching for a patient starting chemotherapy for colorectal cancer? Answer: report severe diarrhea or dehydration immediately. Rationale: colorectal cancer chemotherapy causes gastrointestinal toxicity. Prompt reporting ensures intervention, per NCCN colorectal cancer guidelines. 131. What is the nurse's first action for a patient with a new onset of abdominal pain in ovarian cancer? Answer: assess for ascites and notify the provider. Rationale: abdominal pain may indicate ascites or tumor progression. Assessment and notification ensure timely diagnosis, per NCCN ovarian cancer guidelines. 132. What should the nurse assess in a patient receiving radiation for prostate cancer? Answer: assess for urinary retention and bowel changes. Rationale: pelvic radiation affects the bladder and rectum, causing retention and diarrhea. Assessment guides management, per NCCN prostate cancer guidelines. 133. What is the priority nursing action for a patient with a hemoglobin of 6.5 G/DL during chemotherapy? Answer: prepare for blood transfusion as prescribed. Rationale: severe anemia, 8 G/DL, causes hypoxia. Transfusion restores oxygen carrying capacity, per ONS hematologic guidelines. 134. What should the nurse teach a patient about managing chemotherapy-induced peripheral neuropathy? Answer: use caution with hot or cold items and wear supportive shoes. Rationale: peripheral neuropathy causes sensory loss. Avoiding extremes and supportive shoes prevent injury, per ONS neuropathy guidelines. 135. What is the nurse's first action for a patient with a new onset of seizures during radiation therapy? Answer: administer prescribed anticonvulsants and ensure safety. Rationale: seizures may result from radiation-induced edema. Anticonvulsants and safety measures prevent injury, per ONS radiation guidelines. 136. What should the nurse monitor in a patient receiving rituximab for lymphoma? Answer: monitor for infusion reactions and infection. Rationale: rituximab causes infusion reactions and immunosuppression. Monitoring ensures safety, per NCCN lymphoma guidelines. 137. What is the priority nursing action for a patient with a new onset of shortness of breath in colorectal cancer? Answer: administer oxygen and notify the provider. Rationale: shortness of breath may indicate metastasis or embolism. Oxygen and notification ensure rapid intervention, per NCCN colorectal cancer guidelines. 138. What should the nurse include in teaching for a patient starting immunotherapy for melanoma? Answer: report new symptoms like cough or diarrhea immediately. Rationale: immunotherapy causes immune-related toxicities. Prompt reporting ensures early management, per NCCN melanoma guidelines. 139. What is the nurse's first action for a patient with a new onset of back pain in breast cancer? Answer: assess for spinal cord compression and notify the provider. Rationale: back pain may indicate metastasis or compression. Assessment and notification ensure timely diagnosis, per ONS emergency guidelines. 140. What should the nurse assess in a patient receiving chemotherapy for multiple myeloma? Answer: assess for bone pain and hypercalcemia. Rationale: multiple myeloma causes bone lesions and hypercalcemia. Assessment guides pain and electrolyte management, per NCCN myeloma guidelines. 141. What is the priority nursing action for a patient with a phosphorus level of 5.5 milligrams per deciliter during chemotherapy? Answer: administer prescribed phosphate binders and monitor renal function. Rationale: hyperphosphatemia from tumor lysis syndrome risks renal damage. Binders and monitoring prevent complications, per NCCN guidelines. 142. What should the nurse teach a patient about preventing infections during chemotherapy for leukemia? Answer: avoid crowds and practice frequent handwashing. Rationale: chemotherapy-induced immunosuppression increases infection risk. Avoiding crowds and handwashing prevent infections, per ONS guidelines. 143. What is the nurse's first action for a patient with a new onset of confusion during immunotherapy? Answer: assess neurological status and notify the provider. Rationale: confusion may indicate immune-related encephalopathy. Assessment and notification ensure timely intervention, per NCCN immunotherapy guidelines. 144. What should the nurse monitor in a patient receiving radiation for head and neck cancer? Answer: monitor for mucositis and dysphagia. Rationale: head and neck radiation causes mucosal damage, leading to mucositis and swallowing difficulties. Monitoring guides management, per ONS radiation guidelines. 145. What is the priority nursing action for a patient with a new onset of fever and lymphoma? Answer: obtain blood cultures and administer prescribed antibiotics. Rationale: fever indicates potential sepsis due to immunosuppression. Cultures and antibiotics prevent progression, per ONS neutropenic fever protocols. 146. What should the nurse include in teaching for a patient starting palliative care for lung cancer? Answer: discuss advanced directives and symptom management. Rationale: palliative care emphasizes patient wishes and symptom relief, improving quality of life, per ONS palliative care guidelines. 147. What is the nurse's first action for a patient with a new onset of leg swelling in ovarian cancer? Answer: assess for deep vein thrombosis and notify the provider. Rationale: leg swelling may indicate DVT, a cancer-related complication. Assessment and notification ensure rapid diagnosis, per ONS guidelines. 148. What should the nurse assess in a patient receiving chemotherapy for bladder cancer? Answer. Assess for hematuria and urinary frequency. Rationale. Bladder cancer chemotherapy causes mucosal irritation, leading to hematuria and frequency. Assessment guides management, per NCCN Bladder Cancer Guidelines. 149. What is the priority nursing action for a patient with a calcium level of 12.0 milligrams per deciliter in multiple myeloma? Answer. Encourage fluid intake and administer prescribed diuretics. Rationale. Hypercalcemia, greater than 10.5 milligrams per deciliter, risks renal and cardiac complications. Hydration and diuretics promote excretion, per ONS emergency guidelines. 150. What should the nurse teach a patient about managing chemotherapy-induced nausea? Answer. Take antiemetics as prescribed and eat small, frequent meals. Rationale. Antiemetics prevent nausea, and small meals reduce gastric irritation, improving nutrition, per ONS supportive care guidelines. 151. What is the nurse's first action for a patient with a new onset of chest pain during immunotherapy? Answer. Assess vital signs and notify the provider. Rationale. Chest pain may indicate myocarditis or pneumonitis, immune-related toxicities. Assessment and notification ensure timely evaluation, per NCCN Immunotherapy Guidelines. 152. What should the nurse monitor in a patient receiving doxorubicin chemotherapy? Answer. Monitor for cardiotoxicity and oral mucositis. Rationale. Doxorubicin causes dose-dependent cardiotoxicity and mucositis. Monitoring heart function and oral health prevents complications, per ONS Chemotherapy Guidelines. 153. What is the priority nursing action for a patient with a white blood cell count of 900/mm superscript 3 in leukemia? Answer. Initiate neutropenic precautions and notify the provider. Rationale. Severe neutropenia, 1,000/mm superscript 3, increases infection risk. Precautions and notification prevent infections, per CDC guidelines. 154. What should the nurse include in teaching for a patient starting radiation for cervical cancer? Answer. Report vaginal bleeding or pelvic pain immediately. Rationale. Cervical radiation causes mucosal irritation. Prompt reporting ensures intervention, per NCCN Cervical Cancer Guidelines. 155. What is the nurse's first action for a patient with a new onset of headache and brain cancer? Answer. Assess neurological status and notify the provider. Rationale. Headaches may indicate increased intracranial pressure. Assessment and notification ensure timely intervention, per ONS Brain Cancer Guidelines. 156. What should the nurse assess in a patient receiving chemotherapy for lymphoma? Answer. Assess for lymphadenopathy and fever. Rationale. Lymphoma causes lymph node enlargement and infection risk. Assessment monitors disease and complications, per NCCN Lymphoma Guidelines. 157. What is the priority nursing action for a patient with a potassium level of 6.5 milliequivalent/L during chemotherapy? Answer. Administer prescribed Kexalate and notify the provider. Rationale. Hyperkalemia, greater than 6.0 milliequivalent/L, from tumor lysis syndrome risks arrhythmias. Kexalate and notification address the emergency, per ONS guidelines. 158. What should the nurse teach a patient about preventing skin infections during chemotherapy? Answer. Keep skin clean and avoid cuts or abrasions. Rationale. Chemotherapy impairs skin integrity, increasing infection risk. Clean skin and avoiding trauma prevent infections, per ONS Supportive Care Guidelines. 159. What is the nurse's first action for a patient with a new onset of dyspnea in breast cancer? Answer. Administer oxygen and notify the provider. Rationale. Dyspnea may indicate pleural effusion or metastasis. Oxygen and notification ensure rapid intervention, per NCCN Breast Cancer Guidelines. 160. What should the nurse monitor in a patient receiving bevacizumab for colorectal cancer? Answer. Monitor for hypertension and gastrointestinal perforation. Rationale: bevacizumab causes hypertension and rare perforation risks. Monitoring ensures early detection per NCCN targeted therapy guidelines.